In Barrett Q1, which would be more in keeping with optic nerve glioma rather than optic nerve treatment glioma, king of the optic nerve and CNS optic nerve glioma. Question number 2. CT shows density enhancing pineal mass with exposure classification. CSF shooting. What other tumor type is this condition related with? Retinoblastoma. Trilateral retinoblastoma shows retinoblastoma plus pineal gland tumor. 3. Which feature would suggest a high-grade neuroplasm rather than an infarct? Elevated choline on MR magnetic resonance spectroscopy shows high-grade neoplasm rather than infarct. On magnetic MRS, elevated choline shows neoplasm. Question number 4. Ultrasound of heart quieter shows enlarged thyroid gland with a lobulated outline. Multiple ill-defined hyperbaric areas are separated by echogenic septa. Diagnosis Hashimoto thyroiditis. Now this, on ultrasound, multiple ill-defined hyperbaric areas separated by echogenic septa. This is only seen in Hashimoto thyroiditis. Question number 5. Multiple skin lesions and seizures, erythematous facial rash in a particular distribution, and subungual fibromas are nowhere in the hands. 3D head, which is not typically associated with this condition, enhancing calcified cortical tumors. If this comes, then it will be diagnosed tuberous sclerosis, but the patient has skin enhancing lesions and seizures, and erythematous facial rash in a particular distribution, so this is systemic lupus erythematosus diagnosis. So it will not have tuberous sclerosis lesion, that is cortical tumor. We will all have all the other things: sclerotic lesion in the skull, asymptomatic calcified retinal nodules, hydrocephalus, and cerebral arterial ectasia. Not associated is enhancing calcified cortical tumors. Question number 6. Which features are not associated with GR2 malformation? Plastic phalanx is not associated with GR2 malformation. Question number 7. Which imaging feature would be more supportive of tumor recurrence rather than radiation injury? Decreased amplitude of N-acetyl NA peak on MR spectroscopy shows tumor recurrence. Decreased amplitude of NA peak on MR spectroscopy shows tumor recurrence. Number 8. Intraaxial cerebral mass most likely diagnosis: hemangioperiocytoma. Intraaxial cerebral mass is hemangioperiocytoma. Question number 9. Repeated seizures most sensitive radionuclide examined to identify the source is 1699 HMPAO spectral imaging is for seizures. Question number 10. Bladder dysfunction and leg weakness. One of the spine shows solitary intradural extramedullary tumor of the thoracic spinal cord, is posteriorly located and is of high signal intensity on T2W. Diagnosis meningioma. Because there are no areas of low signal on T2W, so all these bladder dysfunction, leg weakness, MRI spine shows solitary intradural extramedullary tumor of the thoracic spinal cord, posteriorly located and high signal on T2. Diagnosis meningioma. Correct? It is not astrocytoma. Why? Because in astrocytoma there will be areas of low signal on T2. Astrocytoma is aggressive tumor, will show cystic areas and areas of low signal on T2W. But this is homogeneous and high signal on T2W. The meningioma. Question number 11. A patient presents with bradykinesia, irregular and tremor. At item 123, eye flu pain is administered and measures required outpost injection reveal significant depletion of uptake in the corpus striatum, which could not account for these frontotemporal dementia, because the increased uptake is in corpus striatum, so it cannot be frontotemporal dementia. Rest all may be the answer. Question number 12. An incidental cerebral arteriovenous malformation noted on MR imaging, which is associated with a better prognosis through field venous drainage. In cerebral arteriovenous malformation, better prognosis associated with superficial venous drainage. Question number 13. Which appearance would be least consistent with diagnosis of parathyroid adenoma? The focus of increased tracer uptake on textgene-99 and pertactinate, which is localized only thyroid. Now this textgene-99 pertactinate study is used for thyroid gland localization, and in thyroid gland we have to increase tracer uptake, but not in parathyroid gland. Correct? So this is least consistent with diagnosis of parathyroid adenoma, because focus on increased tracer uptake on textgene-99 and for only thyroid gland, not parathyroid. Parathyroid will show no uptake. 14. Known HIV and CD4 count of 300 cells per milliliter. MR shows ischemic infarcts within the distribution of the peripheral arteries of the basal ganglia and middle cerebral artery, which is infective etiology, syphilis. It's because large medium vasculitis, An HIV with CD4 count 300, and then they're ischemic infarct within the distribution of the peripheral artery of the belly and middle cerebral artery. So most likely effect etiology is syphilitis. It causes vessel vasculitis in all of these. Rest don't cause vasculitis. 2015, a 5-year-old CT shows hydrocephalus and a posterior pulsar mass which comprise a cyst and a mirror nodule, whether it's incorrect. Surrounding vasogenic edema is common. Like doing a polycystic isotretoma, but polycystic isotretoma does not have surrounding edema. It's very less edema surrounding. We will see a diagram in the next paper, but polycystic isotretoma shows no edema. 16. Mean transit time, cerebral blood volume, and cerebral blood flow were calculated, which would suggest the presence of an ischemic penumbra. Increase mean transit time, decrease cerebral blood flow, increase cerebral blood flow, decrease cerebral blood volume, increase cerebral blood flow. The patient has ischemia in this, so in the ischemia area there will be increased mean transit time to quickly take blood to the ischemic area, and there will be decreased cerebral blood volume and increased cerebral blood flow to take oxygenated blood cells to the ischemic area. Increase, decrease, increase, increase, decrease, increase. MTT, CBV, CBF. 17. A 60-year-old gentleman with great apraxia and urinary incontinence has hydrocephalus. No obstructive lesion is found. CSF withdrawal provides some clinical improvement. Would be an expected finding. Downward going with corpus callosum. Now the diagnosis is normal pressure hydrocephalus. The 60-year-old gentleman with great apraxia and urinary incontinence. Correct? And then normal pressure hydrocephalus is common in these ages. If there is no obstructive lesion is found, so no cause of obstruction to normal cerebral hydrocephalus, then when they remove CSF from the patient, there's some clinical improvement. What is unexpected? So in any and modern pressure hydrocephalus, there is no bowing of the corpus callosum. 18. Intracerebral hematoma, CT attenuation is 70, and there is a fluid level. How old is hematoma? 3 to 48 hours. So 70 HU is seen in 3 to 48 hours. Hematoma. 19. Silent MRI shows thoracic intramedullary mass, hypointense on T1, hyperintense on T2, and enhances intravenous of intravenous gadolinium. Most likely diagnosis is sarcoma. Now in children, common is and thoracic spinal cord, thoracic mass tumors is astrocytoma. Ependymoma is seen in cervical spinal cord. And astrocytoma is seen in children, and ependymoma is seen in adults. 20. Diffuse axonal injury is suspected. Which structures are most likely to be affected? The splenium of corpus callosum is seen in diffuse axonal injury. 21. Which is the commonest type of cerebral herniation? Subsulfide sign. 22. A thyroid nodule is malignant. Tumor is 3 cm in size and limited to the gland with local staging T2. Thyroid nodule 3 cm and limited to the gland. Staging is T2. 23. What feature would favor diagnosis of a common body tumor rather than schwannoma? Rapid uptake of intravenous contrast medium. It's seen in glomus tumor. 24. How many of Dolan's lines can be interrupted by a tripod facial fracture? 3. 3 Dolan lines can be interrupted by a tripod facial fracture. 25. A 35-year-old man presents with an focal weakness of the left arm. He had suffered from migraine in the past. The CT had revealed a lacunar stroke and white matter hypertension with particularly affects the subcortical region and extended to the temporal plane. White matter change did not enhance of the mysterium intravenous contrast medium. Diagnosis CADASIL. Stands for cerebral autosomal dominant arteriopathy with subcortical infarct and leukoencephalopathy. What it does is it causes infarcts in adults and young males. It causes infarct. So it causes strokes in young males. This CADASIL disease. It stands for cerebral autosomal dominant arteriopathy. So when there's always a young patient, 35-year-old about, and he has a history of lacunar strokes, then suspect CADASIL. And then he has lacunar strokes, it affects subcortical region and extends the temporal lobe. So a young patient with strokes, I suspect CADASIL.